The purpose of today's video is to congratulate you on making it this far. Tomorrow is your surgery. I know that you are nervous and probably have a lot of last-minute questions. This is completely normal. Tonight, I want you to go to bed early as best as you can. Do not eat any solid foods after midnight, and definitely not when you get up in the morning. You may continue to drink the Gatorade or Thrive Recovery drink up until 3 hours before your procedure. However, if your surgery is first case in the morning, with an arrival time at the surgery center or hospital earlier than 6:30, I would recommend not drinking anything at all, just to be safe and avoid any risk of your surgery being canceled. You should not drink the protein drink after midnight or the morning of your surgery. If you do, your surgery will definitely be canceled by anesthesia. Any medications you were specifically told to take or that you normally take in the morning can be taken with a small sip of water. Also, please brush your teeth. Bad breath is a bad way to start your surgical journey. The surgery center or hospital has typically contacted you by now with your recommended arrival time. If they have not, arriving 1.5 to 2 hours before your scheduled surgery time is generally a safe time frame. The extra time just allows the nurses, anesthesiologist, and myself to answer your questions and get you fully prepared for surgery. Please also understand, I do my very best to stay on time, but occasionally surgeries take longer than expected. If that happens on your day, I appreciate your patience and understanding. My goal is always to stay on schedule, but more importantly, to do what is best for each patient. And I know you would want me to do the same for you. I look forward to seeing you tomorrow.